Good morning, and thank you for joining our weekly COVID-19 briefing. And thank you for your patience as we work through technical problems. Today's briefing will run until 10:30. As always, we're joined by Acting Health Commissioner, Dr. Cheryl Bedegal. One quick reminder that members of the public who would like to watch today's briefing can view the live stream on the Health Department's YouTube channel. We will present remarks first in English, then in Spanish, then open it up to questions from the press. We ask that media outlets coordinate internally to make sure that only one representative asks questions and that we limit questions to 2 or fewer due to our limited time. If we have time for a second round of questions, we'll allow that. Please keep your questions focused on the topic at hand. And with those instructions out of the way, Dr. Bedegal, will you start us off? Uh-oh, she can't speak. Let's see if we can unmute her. One sec. All right, there you go. You should be able to do it now.
Can you hear me?
Yep.
Okay, great. Thank you. So good morning, everyone, and welcome back. I wanted to start off by updating our numbers today. So since the last time we talked, 1,061 more Philadelphians have been diagnosed with COVID. The previous week, September 1st through the 8th, there were 1,600 Philadelphians who were diagnosed with COVID. So as of yesterday, we're seeing an average of 250 new cases per day, which is down from a high of 313 per day, which we saw on September 4th. Only about 4% of the test results we're receiving are positive, which is a good sign that we're catching most of the virus that's circulating. In terms of vaccinations, yesterday we reported more than 1,025,296 Philadelphians who have received at least one dose of COVID vaccine. That's 82.6% of adults. And 841,821 Philadelphians are now fully vaccinated, which is 67.8% of adults. Yesterday, we reported that 45,349 teens between 12 and 17 have received at least one dose, showing steady progress there. I want to announce a new data set that we're making available starting today. Data on breakthrough cases, hospitalizations, and deaths. But first, I want to explain a bit about what a breakthrough case is, what we interpret these data to mean, and what it means for you. So vaccine breakthroughs mean that a disease has broken through the protection given by the vaccine to some degree. It's important to note that all vaccines have breakthrough cases. This is not just a COVID vaccine thing. So we expect to see some people who have been fully vaccinated test positive, and some number of those people even end up in the hospital, and an even smaller number of them dying. But because we have this data, we know that less than 5% of all cases in COVID in Philadelphia since January have been among people who are fully vaccinated, which means that 95% of people who tested positive weren't vaccinated. Only 3.5% of all the people who've been sick enough to go to the hospital for COVID were fully vaccinated. Or put another way, 96.5% of people who've been hospitalized for COVID in Philly weren't vaccinated. And 98.2% of the 1,184 Philadelphians who have died from COVID this year were not vaccinated. These vaccines work. The data that's going up on our dashboard today will show the month-by-month breakdown of how many cases and hospitalizations happened each month this year, and how many of them were in people who were vaccinated. And every month, the vast majority of those testing positive, being hospitalized, and dying weren't vaccinated. Another interesting thing to note from these data is that the overall number of cases, hospitalizations, and deaths has really dropped as more and more of us have gotten vaccinated. I believe that our high vaccine rate is why we're not seeing all of the cases, the overfilled hospitals, and the deaths that other states with lower vaccine rates are seeing. Again, these vaccines work. You're going to hear some people say that these data mean the COVID vaccine doesn't work. It's not true, and it would be a misunderstanding of the data. So let's walk through why that is. Imagine a group of people of whom 80% are vaccinated. I'm going to choose round numbers to make this easy. If the vaccine were ineffective, we would expect 80% of hospitalizations to also be among vaccinated people. But if, as we're seeing in national studies, the risk of hospitalization is about 10 times higher among people who are unvaccinated as among those who are vaccinated, we would see about 2.5 times as many hospitalizations among unvaccinated people as among vaccinated people. So that accounts for 10 times the risk, even when the vaccinated group is 4 times larger than the unvaccinated group. So the 80% vaccinated, 20% unvaccinated. So for example, here in Philly in August, a total of 343 people were hospitalized because of COVID. 66 of them had been fully vaccinated, 277 had not. So that means that about 80% of hospitalizations were among those not yet fully vaccinated, while only about 20% of the hospitalizations were among the roughly 80% of Philadelphians who were vaccinated at the time. The math works, and so do the vaccines. By getting fully vaccinated, you're not only lowering your chances of having severe COVID, but you're also lowering the risk to everyone who's around you. Being vaccinated is the best way to protect your loved ones, including and especially children who can't get vaccinated yet. Speaking of children, you may have heard that we're starting to see children in schools test positive for COVID. Our team is in contact with the school district, the archdiocese, charter, and private schools throughout the city to see if anyone tests positive and then working with them to quarantine the right people. In most cases, that's just a few people. In other cases, where there are more people testing positive, it could be an entire grade or even an entire school that needs to pause in-person learning. The best way to avoid that situation is to layer on as many protections as we can. With everyone who's eligible being vaccinated, masks on throughout the school day, hand hygiene, and contact tracing, and parents cooperating with isolation and quarantine, we can slow down the spread of the virus and we can keep our schools open. But that takes a partnership across the city. It takes every parent making sure that they and any children 12 and over get their vaccines and get them now. And it takes parents letting school nurses know if their child tests positive and following the instructions their school nurse gives them. So as always, if you would like more information, including being able to see our newest data set on breakthroughs, please visit our website at phila.gov/COVID. If you have questions, please call our COVID call center at 215-685-5488. Thank you. Now Zelly will present these remarks in Spanish. I hope, unless she's muted.
Billy, you should be unmuted if you can.
Am I on video? Am I on video? Because I can't see myself.
Nope, your video is off.
I don't know how to turn it on. I'm so sorry. Something went wrong. Is it okay if I just read without video?
Yep, go ahead.
Okay. Sorry about that. Buenos días y bienvenidos de nuevo. Quería comenzar actualizando nuestros números hoy. Primero, desde la última vez que hablamos, 1,061 habitantes más de Filadelfia han sido diagnosticados con COVID. La semana anterior, del 1 al 8 de septiembre, hubo 1,600 habitantes de Filadelfia que fueron diagnosticados con COVID. A partir de ayer, estamos viendo un promedio de 250 nuevos casos por día, lo que es menos que a un máximo de 313 por día que vimos el 4 de septiembre. Solo alrededor de 4% de los resultados de las pruebas que estamos viendo son positivas, lo que es una buena señal que estamos atrapando la mayor parte del virus que está circulando. En términos de vacunas, ayer informamos que más de 1,025,296 habitantes de Filadelfia han recibido al menos una dosis de la vacuna COVID, que es el 82.6% de los adultos, y más de 840,000 habitantes de Filadelfia ahora están completamente vacunados, que es el 67.8% de los adultos. Y ayer informamos que 45,349 adolescentes entre 12 y 17 años han recibido al menos una dosis, mostrando un progreso constante. quiero anunciar un nuevo conjunto de datos que estamos poniendo a disposición a partir de hoy. Datos sobre casos innovados, hospitalizaciones y muertes. Pero primero quiero explicar un poco sobre lo que es un caso innovador, lo que interpretamos que significan estos datos y lo que significa para usted. Los avances en la vacuna significan que una enfermedad ha roto la protección dada por la vacuna hasta cierto punto. Es importante tener en cuenta que todas las vacunas tienen casos innovadores. Esto no es una cosa de vacuna COVID. Así que esperamos ver a algunas personas que han sido completamente vacunadas dar positivo y un pequeño número de esas personas incluso terminan en el hospital y un número aún menor de ellas muriendo. Pero debido a que tenemos estos datos, sabemos que menos de 5% de todos los casos de COVID en Filadelfia desde enero han sido entre personas que están completamente vacunadas, lo que significa que el 95% de las personas que han dado positivo no fueron vacunadas y solo el 3.5% de todas las personas que han estado lo suficientemente enfermas como para ir al hospital con COVID están completamente vacunadas. Dicho de otra manera, el 96.5% de las personas que han sido hospitalizadas por COVID en Filadelfia no fueron vacunadas y el 98.2% de los casi 1,184 habitantes de Filadelfia que han muerto por COVID este año no fueron vacunados. Estas vacunas funcionan. Los datos que se representan en nuestro panel de control hoy mostrarán el desglose mes a mes de cuántos casos y hospitalizaciones ocurrieron cada mes este año y cuántos de ellos fueron en personas que fueron vacunadas. En cada mes, la gran mayoría de los que dan positivo son hospitalizados y mueren, no están vacunados. Otra cosa interesante a tener en cuenta a partir de estos datos es que el número total de casos, hospitalizaciones y muertes realmente ha disminuido a medida que más y más personas se han vacunado. Creo que nuestra alta tasa de vacunación es la razón por lo que no estamos viendo todos los casos y hospitales sobrecargados y las muertes que otros estados con tasas de vacunación más baja están viendo. Una vez más, estas vacunas funcionan. Vas a escuchar a algunas personas decir que estos datos significan que la vacuna COVID no funciona. Eso no es cierto y sería un malentendido de los datos. Vamos a repasar por qué es así. Imagine una población de 100,000 personas, de las cuales 80% están vacunadas. Si la vacuna fuera ineficaz, esperaríamos que el 80% de las hospitalizaciones fueran entre las personas vacunadas. Pero sí, como estamos viendo en estudios nacionales, el riesgo de hospitalizaciones es aproximadamente 10 veces mayor entre las personas que no están vacunadas que entre las personas que no están vacunadas. Veríamos aproximadamente 2,5 veces más hospitalizaciones entre las personas no vacunadas que entre las personas vacunadas. Eso representa 10 veces el riesgo, pero para el grupo vacunado es 4 veces más grande que el grupo no vacunado. En agosto, un total de 343 personas fueron hospitalizadas a causa del COVID. 66 de ellos habían sido vacunados completamente, 277 no lo habían hecho. Eso significa que alrededor de 80% de las hospitalizaciones se encontraban entre los que aún no estaban completamente vacunados, mientras que solo alrededor del 20% estaban entre aproximadamente el 80 de los habitantes de Filadelfia que estaban vacunados en ese momento. Las matemáticas funcionan y también lo hacen las vacunas. Al vacunarse por completo, no solo está reduciendo sus posibilidades de tener COVID grave, sino que también está reduciendo el riesgo para todos los que lo rodean. Vacunarse es la mejor manera de proteger a sus seres queridos, incluidos y especialmente a los niños que aún no pueden vacunarse. Hablando de niños, es posible que haya escuchado que estamos empezando a ver a niños en las escuelas que dar positivo por COVID. Nuestro equipo está en contacto con el distrito escolar, la arquidiócesis, escuelas charter y privadas en toda la ciudad para ver si alguien da positivo y luego trabajar para poner en cuarentena a las personas adecuadas. En la mayoría de los casos, eso es solo unas pocas personas. En otros casos donde hay más personas que dan positivo, podría ser un grado completo o incluso una escuela entera que necesita pausar el aprendizaje en persona. La mejor manera de evitar esa situación es colocar tantas protecciones como podamos. Con todos los que son elegibles siendo vacunados, máscaras puestas durante todo el día escolar, higiene de manos y rastreo de contactos y padres, cooperando con el aislamiento y la cuarentena, podemos frenar la propagación del virus y mantener nuestras escuelas abiertas. Pero eso requiere una asociación en toda la ciudad. Se necesita que todos los padres se aseguren de que ellos y los niños de 12 años o más reciban sus vacunas y las reciban ahora. Y se necesita que los padres les hagan saber a las enfermeras escolares si su hijo dio positivo y sigan las instrucciones que les da su enfermera escolar. Como siempre, si desea obtener más información, incluida la capacidad de ver nuestro conjunto de datos más recientes sobre avances, visite nuestro sitio web en phila.gov/COVID. Si tiene preguntas, llame a nuestro centro de llamadas COVID, el 215-685-5488. Thank you.
Thank you very much, Zoe. Next, we'll move to Q&A. Again, reporters are asked to limit their questions to 2 or fewer and stick with the topic at hand. If we don't get a chance to answer your question, please let us know via email and we'll get you an answer later today. First up, we will go with Maggie Kent at 6 ABC. Go ahead, Maggie.
Hi, thank you for taking my question. I had a question in terms of testing availability. We're hearing from some people that it's been difficult to find tests within the city, find appointment for tests, and even find tests that you might be able to use at home. Have you heard or seen any of that? And is there any reason as to why there's a difficulty in finding testing?
So we had heard a little bit about that, and so kind of reached out to multiple sites across the city to make sure there was still availability and found that there was. I think more people are getting tested now. In part, a little bit of that is the rise in cases. I think probably more of that is requirements for testing, either for jobs or for entry into various locations. So, we are anticipating that demand to go up, which is why we were reaching out to make sure capacity is there. There should be scalability from what we're hearing from the various testing providers around the city. So, I think if people do have trouble tests, they should call some other sites or look. We have our phila.gov/testing site still up. You can filter for different needs on that site, whether it's the age of the person getting tested, the location, whether you have a script from a doctor, et cetera. So, I would advise people to use that site. But there currently, it does appear to be capacity in the system.
Is there any plans to scale up testing? Just because now we're hearing about the federal mandate, people will have to get tested every 2 weeks. All our kids are back in school. People are back at the office, as you mentioned.
Yeah, so there is a separate system for testing in schools. So there's federal money that went to the school district to do testing there on site. We're working on an RFP for a provider to do testing for other schools. So, we don't want them to have to compete with other people for testing. But yeah, we're definitely keeping an eye on this. As demand for testing increases, we may need to work with providers to see if there are ways to scale up what they're doing. But what we're currently being told is that they have the ability to scale up if needed.
And then in terms of hospitalizations, our data team found that they were up just slightly. I know last week when we met, you were saying that we were hopefully had reached the curve in earlier September and then are coming down. Do you still feel like that's a trend that we're seeing?
Our number of cases has decreased over the last week. Hospitalizations and deaths lag with COVID. It's a slow disease. So, I'm still feeling reasonably confident that we're not going to see a sharp rise in hospitalizations unless our case rate goes up a lot. We did see a little bit of wiggle, but there is some wiggle with hospitalizations. Yesterday, the number admitted was relatively low. So, I think this is all kind of within that range of day-to-day wiggle in data. But all of this, we have to keep a very close eye on.
Thank you very much, Maggie. Next up, we're going to go to Lauren Make at Channel 10. Go ahead, Lauren.
Hi, good morning. Dr. Bettigal, you mentioned that in schools, the situation has varied. What's the threshold for when you recommend that they pause in-person learning, and how many times have you done that this school year?
So it depends on whether we're talking about a classroom, a grade, or an entire school. And the numbers vary, and we look at, is there in-school spread? Are the cases all isolated to a single classroom or a single grade, or are they more kind of scattered? Currently, there have been 3 schools that have been put on pause. We are looking at our criteria almost daily, just trying to make sure that what we do is consistent with the CDC, makes sense for the situation here in Philly, is both safe and designed to keep kids learning. So it's a constant, it's something we're discussing constantly. So there may be changes in the guidelines going forward, but currently we have 3 schools on pause.
Are those all district schools or archdiocese or?
No, I believe 1 is a district school and 2 are charters.
Okay. And then in terms of schools and children and how transmission is happening with them, what are you learning about where and how transmission is happening with students, and how are you finding out about it? Is it through regular testing or just symptoms that kids are having?
So it's a mix, but I will say, and most of what we know about this is based on our experience over the summer. School has only been in session for the fall for a very short period, but in general, most transmission is not happening at school, it's happening at home. And so most of the cases we see end up being sporadic. If you see 2 close together, they're often siblings. There can be in-school spread, and there has been a small amount of in-school spread, but this is one of those situations where the reason I keep harping on parents getting themselves vaccinated, getting their teenagers vaccinated, not sending kids to school if they're sick, listening to nurses, all of this is because almost all the spread, not all the spread, but most of it is happening at home and then coming into the school that way. And of course, you can get in-school spread in that situation, and that does happen, but that's not where most of it is happening. I think for most of us, we imagine most of it happening in school because all these kids are together, that must spread COVID, but it's typically the adults bringing it home and then spreading in the house.
Okay, and then the last part, did you answer that about the, how are they finding out about it? Do they have symptoms or testing or?
Well, so it varies. I mean, so if a child is sick and gets tested, we would find out that way. If a child is symptomatic at school, the school nurse can test them. We would find out that way. The school nurses are in communication with our schools team.
Okay, thank you.
Thank you very much, Lauren. Next up, we're going to go to Jack Tomzik from the Metro. Go ahead, Jack.
Thank you for taking my question. Dr. Bettigal, why release this data on breakthrough infections now?
People keep asking about it. And so, we really do strive for transparency. The state released data yesterday for Pennsylvania. So it seemed like it was time to really let people see what we know in Philadelphia. I think it is, the reason it takes all this interpretation and the reason I spoke for longer than I normally do is that if you look at the raw numbers, it's easy to be confused. And you have to understand the cases in the context of an increasingly large population of people who are vaccinated.
And do you think stories about these breakthrough cases are making people more hesitant to get the vaccine?
Well, one of the reasons that I meet with you all once a week is to help answer your questions so that you can frame this for the public in a way that makes sense and helps them to understand what the data means, what all of this means. You are our best communicators. So happy to answer your questions on this because, people are going to learn about this from you. And I'd rather them learn about it from good reporters than, the misinformation that gets spread on social media and on talk radio.
And regarding the schools, are you able to name those 3 schools that had to be put on pause?
I'm going to defer to Jim Garrow on that question.
Jack, we'll send that to you afterwards.
Okay, thanks.
All right. Thank you very much, Jack. We'll now move to Isabel Sanchez from Telemundo. Go ahead, Isabel.
Hola, ¿qué tal, Celi? Mi pregunta es en referencia a este otoño, ¿no? ¿Cuáles son las expectativas para el otoño ahora que los números se están viendo un poquito más positivos? Esperamos que esta es una tendencia que continúe cuando el clima se coloque un poco más frío.
Hi, Dr. Vertigo. Her question is regarding this fall. What are the expectations with regards to positive numbers and what will we be doing in regards to that?
So we don't know yet. Obviously, we're all concerned about a potential surge in cases in the fall when kids are in school for longer, when people are gathering more inside. We don't have to have that surge. If people get vaccinated, if they mask, if parents keep sick kids home and tell nurses when their child tests positive, and if we all are careful about not gathering in big groups inside and about keeping our masks on when we are inside in public spaces, we don't have to have a fall surge this year. So, we'll see where we can get to. But it is not inevitable in Philadelphia with our numbers and with what people understand here about masking and about taking care of each other. A surge is not inevitable.
No sabemos, estamos cómo proceder con para que pasen los números, pero si ponemos a los niños que usen sus mascarillas y los padres mantienen a sus hijos en sus casas si están enfermos, nosotros tenemos el poder de controlar el contacto de COVID en las escuelas.
Ok,
No tenemos.
una segunda pregunta, Celi. ¿Cuál es su mensaje, doctora Vertigo, para los padres que están todavía un poquito apprehensive, un poquito nerviosos al ver estos números de los casos, para reiterarles que se está haciendo lo posible para que ellos estén seguros?
Dr. Vertigo, what is your message for parents that are still a bit apprehensive about getting their kids vaccinated or back into the system in terms of school?
So in terms of the vaccine for parents who are worried about vaccinating their teenagers, a couple of things. We have a tremendous amount of data on the safety and the efficacy of these vaccines. We have more data really than we've had on virtually any vaccine because we're following this one so closely. I will also say, as a parent, I have 3 sons. I got my sons vaccinated as soon as I possibly could, because I knew that was their best chance at safety. And, this is less likely to cause severe disease in kids, but it does. There are children in Philadelphia hospitals right now because of COVID. So I think, none of us want to take a chance with our kids. The much bigger chance we take is if we don't vaccinate them than if we do.
Sobre las vacunas tenemos mucha información sobre la eficacia de ellas y los datos también. Y como madre de 3 hijos, la vacuna es lo mejor que podamos hacer para prevenir el contacto de virus.
Muchas gracias. Thank you so much, doctor.
De nada.
Thank you very much, Isabel. And as we have hit 10:30, we are going to wrap things up today. Thank you all very much for joining us, and we will announce next week's briefing via Twitter and media advisory when the time and date are set. Thank you again for joining us, and please be safe.